Welcome everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. First, before we talk to Dr. Fine, let's thank Rebecca Cotto da Silva from joining us from Bolzano, Italy this morning. Italy is about 3-4 weeks ahead of the United States in dealing with the virus. Very insightful in that major rollbacks in their restrictions were supposed to hit over the weekend. Those are really being delayed, so very, very interesting response by the Italian government. I also want to thank John Giorsi, one of our co-founders of GoLocal, Broadcasting Hall of Famer, iconic weatherman, and just all-around great person for joining us. Well, 1 o'clock we'll have the governor's briefing, and at 2 o'clock, Scott Cordisci will join us, superstar sports analyst, and another one from the Go Local team. So Dr. Fine, let's go to it. Lots of news about the virus. Numbers are driving a lot of the discussion around the country. Let's talk about those numbers now.
Great. Around the world, over 1 million people have recovered, 3.3 million tested cases around the world. That number is growing, and I think we again need to keep our eyes on the developing world, because I think that's where we're going to see much of the pain, unfortunately. 1.1 million Americans tested positive, still growing robustly. The notion that we are done in the United States, I think, is not proven, and my guess is it will bubble at different rates in different places. New York may be shrinking, but I'd be watching other population centers, because the number of new cases increased. The number of deaths around the world continues apace. Unfortunately, 235,000 deaths around the world, 64,000 deaths in the United States. Anybody who wanted to argue that this is just seasonal flu, they just lost that argument, because this is more than we get in a typical whole year of seasonal flu. We got today's numbers from Rhode Island already, a little early. The Rhode Island numbers are overall encouraging. If you look at ICU use and hospital use, though hospital numbers jumped over the last 2 days, though as I understand it, that's more reporting than new cases, though the number continues to grow. We are almost 100 more hospital beds occupied today than we had a week ago, at about 352. We will cross 9,000 tested positive cases in Rhode Island today or tomorrow, and we unfortunately had 13 more deaths. I cannot say, looking at these numbers, that we have hit our peak and are declining. I think we're on that high plateau now, and we're going to see these numbers, 10 to 15 deaths a day, and 350 or so new cases a day, probably for the next week or 2 or 3 before we can look for a decline, unfortunately.
Yeah, I want to go to the national numbers for a second, because I think you have a bunch of states opening up. I think there's 31 states that are pulling back restrictions in one way or another over this weekend and into Monday. Yesterday was over 2,000 deaths, I believe, in the United States, and that was up over the previous 3 or 4 days. I think we'd gotten down to around 1,200 on Wednesday or Tuesday. We're just not seeing much let up, and in New Jersey, I think they had their highest number of deaths, around 600 in the past 48 hours. So those trends are not good and don't point to pulling back restrictions, unless you're just making a decision about pulling back restrictions because you have to get the economy going, don't you think?
Well, I think it depends on where you are and what the disease is doing where you are. To paraphrase a political statement, I think all COVID-19 is local. Mm-hmm. So that, I can't remember which state, but I think it was Texas, I heard. They are treating counties that have very few cases differently than they are treating counties with many cases, and that to me is logical if you have the public health infrastructure in place. But I think this is going to really test our social fabric in a difficult way, because there are places that are mostly white that we're going to say, okay, you guys can open. And then there are places that are mostly people of color. We're going to want to say, based on the disease progression, you shouldn't open. And how we be one people in that context, given our history of bias and racial conflict and inequality, I think that's going to be the big question that we struggle with over the next week or two as we try to sort out opening. I think this is going to turn out to be about our history of inequality and our undealt with history of race and racism.
Well, in Texas, West Texas is a long way from Houston, so that's a lot further than Providence, Rhode Island is from Vermont. So I think that makes more sense. But in Rhode Island, we're 40 by 50 miles. We may be look very, very different and have much different affluence in certain aspects of the state. But the next 5 days, Saturday, Sunday, Monday, Tuesday, Wednesday, are supposed to be 70-degree sunny days for the most part. You're going to see Rhode Islanders get up and out of their houses and move around, and folks in Barrington are going to interact with folks from Pawtucket, whether they like it or not, in some way, shape, or form.
Yeah, and that's another part of the challenge. I mean, I think it's in Ireland where they have restricted movement to 2 or 2.2 kilometers away from your home. And, so if you did something like local opening with movement restriction, you might be able to get away with it in places with a low incidence of disease. Otherwise, you have the problem that you just laid out, that people are going to be in the same place together and disease is going to pass from one to the next. I don't know how we're going to work that out, but I think this is a time of thoughtful, cautious, looking hard at the evidence and making evidence-based decisions every place we go. Getting, again, temperature checking, using testing, using contact tracing. I will say that I've recently heard that contact tracing I'm endlessly impressed by this. The contact tracing is now happening within 2 or 3 days of a positive test, which is great improvement. We still have the problem that we are 2 to 3 days before people get a test, sometimes 4 days once they develop symptoms. And then, at least in Central Falls, there's a 5.5 day turnaround time for test results. So it still means that you can be 9 days from the time of symptom development till the test comes back in another 2 days. So that's 11 days before contact tracing happens. That's a long, long time. And we're, clearly we're working as a state decides to try to shrink that, but that's what we got to keep working on.
We've opened a number of new testing facilities, especially in the urban corridor. Overall testing, though, is kind of up and down. We're not seeing a spark of new overall testing that I would have anticipated. One day we had an 1,800 test day. We're not at 3,000 consistently or 4,000 consistently. Do we kind of check a box and then fail to keep reminding people and doing the public education that's necessary to be able to move people to understand how important this is and what the resources are that's available to them?
Yeah, I have talked about, and I worry about sometimes, what I'll call an epidemic of testing tested positives. That we know a lot about people who are tested positives, but we haven't gotten so aggressive at, both testing people when they need to be tested, but intervening early and letting people know what to do the moment they get a symptom. So, we've got testing will help, but we also have to combine it with really robust and granular public education so that everybody in every house, every neighborhood, every block knows what to do when they get a fever or when they get a cough. It needs to be as simple as tying your shoes. You just know it. It's part of what you do, and it's part of everyday life. Testing's a part of that, but I think we need to really emphasize that other stuff if we're going to really reduce disease transmission and if we're going to get the economy open again.
Another issue is that every day the governor has a new message. That's great, and there's always something new in developing across the board, but that doesn't help with reinforcing some previous messages that actually may be more important than so-called the flavor of the day. Are we doing enough? Do we have 5 messages that we are sure have gotten out to every Rhode Islander, regardless of where they live, regardless of what language they speak? Are we sure that those 5 messages, there may be more, there may be less, is getting out there and is getting updated?
I don't know, and I don't know how we're testing it. So I'm always interested in the governor's advice that everybody should have a notebook and keep a diary of everyone they've talked to. From a public health perspective, it's great advice. I'm not convinced that I know how many people are actually doing it, and my seat of the pants is the number is scathingly small. And so, one can imagine a world in which we have a more sort of consistent message process. So we have a message and then we test with focus groups or surveying how effectively it's getting out there. And if it's not getting out there, then we develop a process to make sure that we get to the level of understanding and the level of participation we need for it to be meaningful. I mean, I think that's true of the diaries. I think that's true of people understanding what they need to do to get into isolation if they get sick. I think it's true of people understanding who to call when they get sick. I don't think that has percolated through, and I think there's a real great opportunity to focus on testing the message as it has arrived, and then continuing to work with our communications folks to make sure that the level of understanding is really there. Not just having people watch television or watch news conferences or even watch this broadcast, but testing whether we actually got there in terms of that understanding.
Dr. Fine, as you see this play out, we're 2 months into it. Rhode Island's first case hit on March 1st. It was an administrator coming back from a trip to Italy on a school trip at a parochial high school in Pawtucket. That was case number 1. As you look back and analyze that, none of us has taken any time to look back at any of this because we're just constantly bombarded with new information and trying to get that out. But over the past 60 days or so, what are you surprised at? What are you disappointed at?
I'm surprised that we did as well as we've done with social distancing. That's a good thing. I think I'm disappointed in our relative inability to think out of the box and to be honest about the things we did and said that weren't accurate. I think we did a lot of harm when we said that the disease couldn't be transmitted unless you were symptomatic. I mean, that was a doctrine, kind of a dogma for the first couple of weeks. That hurt us. And we just kind of switched off it and didn't say, how come we did that? And how can we not sort of put out a message that isn't accurate? And how can we stop assuming that this virus is somehow different from any other virus? And how can we just give people good advice and stand on the good advice and be really careful not to say stuff that is going to turn out not to be true? I don't think we have learned from that yet. And I think the opportunity is to challenge those dogmas. I think we're going to have, as we begin to open, some opportunities that we ought to explore in a different way. And I don't think we can message through them. I kind of think we have to listen through them. And that's what I'd like to see us do differently. Not so much, here's the party line, you're going to take it whether it's true or not, but let's listen to every community. Let's figure out what every community needs and understand that those needs are different from place to place, and develop a flexibility to be able to address people where they are and give them address their needs as their needs exist.
Yeah, I think one that's going on right now is a little worrisome. And, I consume a lot of news, obviously. probably more than the average American. And there's a lot of discussion right now about some potential early stages in some treatment breakthroughs. And I think they're being overblown. Some of them are showing, statistical nuance improvements. Others are more poignant. But even Dr. Fauci yesterday was on CNN talking about, oh, I'm very optimistic about this or very optimistic about that. Maybe we'll have a vaccine by January. Those things are hopes and prayers. And as we all know, the complexity of finalizing a vaccine, testing the vaccine, producing the vaccine, and distributing the vaccine is a wildly complex challenge to our country. The fact if it has to be refrigerated versus non-refrigerated could add months to the distribution channel because of just the limitation of refrigerated trucks, refrigerators to put it in. And I think that has to be, I know it's good for the psyche and maybe it's good for the stock market, but I think being honest with Americans, that's a little worrisome.
Yeah, I think you're right. I mean, I think a treatment regimen is going to take a long time. This is an early suggestion, and maybe we can build on it. Maybe we can learn to use this drug in a different way over time. But the process of science is just not instant. And, that process is going to take months. And then if this doesn't prove out, then how do you deal with that disappointment? Instead, I'd like to see us as a nation kind of switch to what I haven't seen yet, which is really kind of create almost, I hate to use the analogy, but almost like a war footing, where we devote all our energy and resources to fixing the problem, to making enough PPE so that nobody's scrambling around, and do that with a real national distribution system. Sort of the stuff we did during the Second World War to make airplanes and Jeeps. We retooled ourselves really quickly, and then, obviously neither of us were alive, so I don't know that, I don't remember it, but my sense is that we really jumped on it and did it as a people, as one nation, with all our energy and commitment. We haven't done that for PPE yet. We haven't done that for testing yet. We haven't really even done that for vaccine and drug development. We're kind of letting this market approach that we have to the world, sort of we're saying, gee whiz, you guys do what you want, and then, shop as you go, and we'll hope that there's an answer. I think this answer is going to take much, much more concerted collective effort, and we need the leadership. We need real leadership to get us there.
Dr. Fine, you always have the last word. What should people know going into this weekend?
Well, it's a good weekend. Make sure you get outside, get some sun. Make sure you use the social distancing that you need to use. Think about how we make sure we take care of everyone. Think about how we make sure that anybody who's homeless gets housed, anybody who's hungry gets fed, and anybody who's threatened with disease gets the resources they need to stay safe. Not just think about what you're going to do this weekend, but think about how we can do this best together, because that's the way out at the end of the day. But have a good weekend, everybody.
Dr. Michael Fine, thank you as always. For everybody else, 1 o'clock, Governor Raimondo, and 2 o'clock, Scott Cordisci. Excited to have Scott Cordisci Skyping in as well. Everybody stay safe. We'll see you back in a little while. Dr. Fine, you stay safe. That's maybe most critical. I think you should be Bubble Boy for the weekend to resurrect that Seinfeld episode. Pure Bubble Boy.
I have
thanks, everybody.
Thanks. Take care.